Hey, Barbara.
Hi, Dr. Lyons.
How you doing?
Good morning.
Good morning.
How are you?
How you been? Okay, so you're here today to talk about your face.
Yes.
Right? So what are you concerned about?
Well, I have signs of aging.
Yeah.
So I'm interested in having something up and with a natural look and pulled up.
Okay. So let me...
Natural, yes.
Oh, very natural. That's the operative word. So let me use this mirror to get more specific. So could you break that down into priorities? What specific... I know in a general sense, you're looking at something getting more vertical.
Mm-hmm.
In a general sense, are there any specific areas?
Feels that everything has dropped, so
Okay.
I'm looking to go here without doing too much to the eyes. I don't want to look tight.
Okay.
And then under here.
Excellent. All right. So you're very similar to most patients that I see today. The one thing that most women don't want is to look too tight or to look done, which is really a thing of the past.
Right.
And there's a way that we do a procedure where you cannot look that way, even if I try hard. I'll explain that to you by using your photograph. So with all due respect, if I can analyze your face artistically. So the specifics that you have that determine the emotional feeling I get when I look at your face. In my face, and all of us who are not young anymore. Basically, it's a lot of vertical lines. So when I look at you as an artist, I want to take away verticals, create stronger horizontals. So the image is one of change without looking artifactual. So the old facelift is where they did everything at the skin level. And they would just undermine the skin and pull really tight. So a man or a woman looked really flat, vectorized, and rather unattractive. If you go back and look at your yearbook, no one ever looked like that when they were 18. So why are we trying to do that now? Basically, if you understand the process of facial structures as they move, all the different layers move in different directions at different times. And that determines what an art class would be taught as to how to create a face that looks 30, 40, 50, 60. And what we try to do is reverse all those processes in a very natural way. It should cause you great comfort to know that I'm not going to create something that's beyond the scope of your bony architecture. So if you look at your photographs here, basically the angle down here, of course, most people have some excess skin, but that's easy. Excess skin is easy, you reject the skin. More importantly is what I call the cheek fat, which is this triangle right here. So if you try to get your eyes through the skin, down beneath, you'll see a piece of fat here that's fallen off the bone. When you think of the Norman Rockwell kids, they have these big cheeks. As we get older, that falls off the bone, flattens, and creates the deep nasolabial fold, hollowing out here, and a jowl here. So really the pivotal part of a good cheek and neck lift is to ignore the skin and to get inside and to take this fat and put it back up here. I can show you that on my face. If I lift that up here, my cheekbone becomes more youthful. This ameliorates, and this ameliorates also. That's what happens in the face, creating more horizontal dimension, loss of vertical, loss of vertical. That's the cheek. And then in the neck bar, we have a different situation where we are talking about two dimension. So here we have not only excess skin, which is typical, but we have some bands of muscle. What happens as we get older is the muscle separates and contracts this way. So what I do through a very tiny incision here is sew these muscles together, then pull these muscles up like this, so your neck and jawline are recreated to look like they did in a more youthful era. That will last longer than just basing the repair on the skin. So it's a muscle repair and not overdone from that point of view. A few things. Post-operatively, little to no pain. Intraoperatively, you feel nothing. Basically, we have you come in and we'll get you orally sedated. When you're comfortable at 30,000 feet, we take you into our beautiful operating room and we'll get the process underway. It takes about an hour and a half. And then you'll go home and rest tonight, and then you come in tomorrow, we'll take your dressing off. Any concerns?
I guess there's just like a couple of questions.
Sure.
One is the sutures.
Okay.
Are they're internal sutures?
There's two series of sutures. So if you look at the where we put the incision line, great question. You can see there's a natural fold here around your ear. So what we do is we use a curvilinear line right in that fold, And in 32 years of doing this, I've never had a patient complain of the incision site not disappearing, all right? All the stitches dissolve on their own. We put no stitches in that have to come out
Oh, great.
next week or the week after, where they all dissolve on their own.
And the sutures and the line
Same thing here. So if you look at my neck here, there's a natural crease here. It goes right in that crease. And those sutures dissolve. So everything, they're called the lines of relaxed skin tension. So if a plastic surgeon comes up to a cheek and makes an incision along this line, it blends in. If you make it this way, it's against the lines of relaxed skin tension. So here, everything's in the lines of relaxed skin tension. It almost disappears to oblivion. Not a concern. There are certain operations, the scar trade-off is a big concern, like a breast reduction or a tummy tuck. But in facelift, it's not a trade-off.
That's great.
I don't consider that a trade-off at all.
The second concern would be bruising and swelling.
Very
How
uncommon.
much and how long?
Yep. So basically, we use very fine technique. We don't actually use any liposuction in the face where you get uncontrolled bruising or swelling. It's rare to see any bruising. If it does happen, it's in the bottom part of the neck here, because if there is any bleeding or oozing in the neck, it seeps down to here, so you could wear a scarf.
Yeah.
Swelling is not apparent in the area of the cheek and jawline. It does happen sometimes in this area here. If you went to the local Wawa, the guy would not know that you're swollen. You don't look that swollen, but your husband would know that you're swollen, and you know, but that takes about a week to go away.
Well, that's not bad. Yeah.
No. Typically, my patients could take a shower in 48 hours with hair like that and go out to dinner. You know, because all this stuff is going on here. This looks pretty normal. In fact, it looks better right from day one. Those are not typical concerns.
Okay.
Okay? All right.
I think so, yeah.
Excellent.
Right through here.
What?
Yep, we're gonna come right over here. Okay. Hold on, there's Stephanie.
You all set, Barb?
All set.
Ready?
Feeling good with best hands. Thank you so much.
You're welcome. Okay. All set.